Hey everyone, my name's Joseph and I'm 32 from the UK, and I just wanted to create a video sharing my experience of my first 2 weeks from rupturing my Achilles, my left Achilles. So I guess it's worth saying how I did it. So I just over 2 weeks ago, I was playing football on astroturf, and like many other people, felt like someone had kicked me in the back of my left calf. I look around, no one's there, and I immediately feel like something serious has happened to my calf and my Achilles. So immediately I know what's happened, because I have actually suffered from like Achilles tendinopathy in both my feet for a number of years, several years in fact. And I've just managed it, to be honest. I've managed it with my load, how much sort of running I do, and I don't normally feel much pain day to day, which is why I've slightly struggled to fully rehabilitate it, you could say, because when you don't have that everyday pain, you kind of lose maybe a bit of motivation regarding how it sort of rehabs. But anyways, so I ruptured it 2 weeks ago, and I immediately got driven. Well, initially, me and my girlfriend, we drove home, but pretty much straight away, because we live on a first floor flat, immediately I was like, I can't go up these stairs. I couldn't walk, couldn't put any weight on it, and immediately I thought I have to go to minor injuries clinic. So I went there, didn't wait that long. I was put in an aircast boot, which it's basically a fracture boot with wedges in. I had an X-ray and it immediately showed, yeah, you've ruptured it. Did the Thompson test. My foot didn't move, so yeah, it was clear what I'd done. This is the X-ray that was done at the minor injuries clinic, and they kind of quickly just showed me that obviously you can see the tendon is meant to be a thick black mass on the X-ray going up sort of the back of the foot. Since then, but here you can clearly see that I was in a bit of pain first week. Frayed. There was swelling, bruising, just a lot of anger in the tendon. Yeah, it didn't feel good in the fracture boot at all. I've done everything right, within 24-48 hours they say you need to be in a boot in a plant-off flexed position, so your toes are bent down, to try and bring the distance between the two ends of your torn tendon together. But at this point I didn't, I'm in the boot, and then it's the first week, and I don't know the extent of the tear or anything like that. I just know that I have a couple of appointments booked with the hospital, the bigger hospital, the following week. So an ultrasound and like a follow-up, basically, with the consultant. So yeah, basically that's what's happened. I mean, mentally, this injury is, as if you've come across this video, you probably tell that, if you watch any other videos, that the recovery is long, it's slow, it basically, it really stops you from doing a lot, especially in the initial stages where I'm on crutches in the boot. I'm very lightly weight bearing, because a lot of the reading I've done and the protocols that I've read is that after week 2 you can weight bear, slightly weight bear, or it's beneficial to, in fact, especially if you haven't had the surgery. So my initial appointment with to have the ultrasound obviously showed that I had the rupture, and the consultant there initially said, yep, you've had the rupture. There's about 3 centimeters gap between the two ends. And he actually said, oh, it's kind of 50-50 between having surgery and not. And he said, oh, if it was my Achilles tendon, I'd probably have surgery. And because he was talking about a bit of fat tissue that was perhaps interfering with the tendon and the potential to heal the tendon. Now, he was difficult to talk to, this consultant. Not a huge fan. He didn't explain anything, and I get it. He's there to do the ultrasound, but he didn't really explain anything to me. So, and I was annoyed with this because I've gone there. I'm the patient. I don't know anything about the extent of my injury. I don't know anything about how bad it is, or how serious it is, or if I need surgery, or if I'm too late to have surgery. All of these things going on in my head. But this consultant kind of throws this bombshell. Oh, you got this thing that might interfere and you might have surgery, and then leaves, basically, because he's not my official consultant that will take me forward in the process. So I didn't appreciate that, because if you think about it from a patient perspective, and many of you will be in the same position, that it's not a good place to be. Like, you don't know how bad this is. This is a really debilitating injury. And for many people, very active, enjoy their sport. I love playing sport. It's my main hobby, is being active, playing sport, playing football, playing cricket, all of this stuff. And when you are the patient and this happens to you, and in the first few weeks, you're kind of told not very much, or you're told conflicting information, I don't understand why doctors, consultants can't be a bit more empathetic about the situation, because you're left to put your foot in a boot, and then that's kind of it. And that annoyed me. I'm not gonna lie, that annoyed me a lot in terms of taking this forward in the first couple of weeks. And it's actually still not quite over, because I went private and asked for a consultant appointment at a private hospital, and he was actually much more relaxed about the whole thing. He said to me, look, don't worry, I haven't looked at the ultrasound, because ultrasounds can be unreliable for this type of injury. They don't show the full picture. And he just discounted the ultrasound as a method to sort of diagnose anything effectively with the Achilles. So he was very good, very reassuring. I was there with my girlfriend, so she was asking questions, I was asking questions. He was very reassuring. He was an older consultant. He'd seen this lots of times, and he just said surgery is not really worth it, he said. So, and of course, by the time I'd seen him, I'd read a lot of the things, I'd been on the Facebook groups, I'd watched a whole load of YouTube videos that was comparing surgery and non-surgery, and he was quite relaxed. He just said, look, in your case, it's not worth the surgery. The healing time, the lack of blood flow, the risks that can be involved, the kind of infection bits and pieces that can come with surgery. He just said to me, it's not worth it. And in all honesty, I was all right with that. Like, I don't want surgery. I don't want it. I'd rather not have surgery. But I was aware that if needed surgery, and if it improves the process, improves the outcomes, improves the quality of the recovery, then I would consider it. But he thought, no, don't. It's okay. You don't really need it. So I came away thinking, all right, fine, yeah, fine. But my only sticking point at this process, at where I am now, so just over 2 weeks, my only problem, or the only thing that is stuck in my head, is that no one has actually looked at any scans. No one has actually seen the full extent of the tear, or one person has, but he didn't really give me a whole lot of information about it. But I just want peace of mind that someone has looked at my Achilles, the internal workings of it, the tear, the area around it, and said, okay, you don't need surgery, or oh yeah, there does look to be something in there that you might want to consider with surgery, and then that's it. Because I don't want to go months down the line in this boot and then be told, oh, it's not healing properly because of XYZ, or because of this or that problem. And I don't want to be in that position. I'm actually getting married in July, and it's already a bit touch and go whether I'll be able to walk, limp free. I won't have the boot on, hopefully, if all goes well, touch wood. But it's that feeling of not having the full picture, not having full peace of mind that the road that I'm on is the road best suited to me, and what the tear is and what it's like. So I have asked to be referred for an MRI from the private hospital. Costs about £300, I believe, if you just scan like a foot, which is obviously what I'll be doing. So and actually I'm quite lucky. I get about £500 cover through my work to pay for scans and imaging and diagnostic stuff. So that's what I have asked for, and yeah, by all accounts, I think I'll be able to get that, and hopefully when they scan it and see the results, and the consultant sees the results, then they can say, oh look, surgery's not worth it, because you're all right, you've been in a boot for 2 weeks in plantar flexion, and you're all right. Like it's kind of the tendon ends are together and there's nothing interfering with it. That's kind of what I want to hear, which is perfect, yeah, perfect conclusion. But at least I'll have the peace of mind then that I'm kind of on the right road, and all I have to worry about is what I can control, which is how I rehabilitate this, the work that I do, the physio work, the care, etc. So yeah, sorry about the shaking in this video. I'm just holding up my camera because I didn't want to just take time setting up and all that stuff. So this is the first video that I've made about my Achilles recovery. I'm 2 weeks in. I'm hopefully due for an MRI to kind of get a bit of a full picture. Pain is not really. Pain is non-existent, I would say, actually. Only thing is sleeping, which can be a bit difficult. This is my Vacoped boot, which I bought from eBay for £100 in the UK last week. So I bought this because the fracture boot, or the aircast boot, which I was put in the initial sort of stages of treatment, so from the hospital, I found it really uncomfortable. Well, the fracture boot is sort of designed for any kind of leg break, ankle problem, and it has 4 wedges in that lift your heel up. Whereas the Vacoped boot is it's not got wedges, it's actually angled at the heel using this kind of clever sort of lever lock system, which you can adjust really easily. And it actually just creates a nicer angle and a nicer feel under your foot. It's really comfortable. It's kind of known as the gold standard boot for Achilles ruptures and the treatment of them. I don't know if they really give them out at the NHS generally. They tend to just give out the normal sort of aircast fracture boot. But this, I started wearing this literally yesterday. So just as about sort of 15 days since my rupture, I started wearing this. And it's really comfortable. I think it's probably a game changer in terms of how I weight bear on this foot now. as I'm going into week 3, and I'm meant to be weight bearing a little bit on this side, and wearing this boot feels much safer, to be honest with you. It makes my heel and foot generally feel very much more solid and safe when I start to put weight on it, whereas the fracture boot, I just didn't like the feel of it, and I always felt like my heel was I always felt like my Achilles was a little bit stretched for some reason in that boot, and I didn't like it. But this, if you can get hold of one of these, absolutely go for it. So in terms of overall pain, it's not too bad. As long as your foot's in this position, it's okay. Swelling's gone down, bruising's gone down. It feels alright, and I can actually put a little bit of weight through. Just over 2 weeks gone, so you know, that's probably a good sign. And right now it is just a case of, you know, staying positive, making sure I read the right information, trusting my consultant, being careful, obviously, and just, yeah, keeping an open mind in terms of how I approach this and all of that, and making sure I reach out to people. You know, don't get isolated. You know, I'm very lucky. I've got an amazing family. My girlfriend, fiance, she's done an amazing job supporting me, doing lots of things around the house. Generally, you know, being amazing. So I'm very lucky to have that, and actually doing this by yourself, being alone, I can imagine would be really quite difficult. But yeah, I'm lucky. I've got a good support network, and they keep me positive, and they keep in touch with me, and I think that is a big thing, because if you're active, if you love going outside, you know, it's getting to springtime now in the UK, this can be a really crap injury, and no doubt I've just started it. I'm only a couple of weeks in, but this is a long road, really long road, and obviously I want to get back to playing sport. I want to get back to playing football, cricket, golf. I want to just walk my dog, run. I want to do all of these things, and it's just a case of accepting this is the situation, and just trying to do my best to, yeah, just recover well, do the protocols that I've been given, and yeah, just find little ways to just try and push along, and yeah, don't get too downhearted about it, I think. So if anyone wants to chat about this, feel free to put in the comments. Yeah, let's support each other. If you're watching this and you've done this, then stay strong, keep in touch with people, you know, let's support each other. I'll see you next time.